Hello, my name is Dr. S. Robert. I'm a UK trained physician based in Canada. I've written over 40 blogs, and this blog is about vitamin D. So, of course, as we know, vitamin D is your sunshine vitamin. Over 90% of it is obtained through sunshine. However, this has to be direct sun exposure to the skin between 10 a.m. and 3 p.m. Any sun exposure you get through a window or the sunroof of your car does not lead to vitamin D absorption. You can get some degree of vitamin D from the diet, but that's less than 10%. This is mostly through oily fish, egg yolk, fortified milk. The type of cooking also matters. So baking fish would preserve its vitamin D content, while frying it would reduce it by over 50%. In most cases, vitamin D deficiency would be asymptomatic. Sometimes some patients do experience muscle pains, tiredness. Immunity can be somewhat reduced. In severe cases, children can have bow legs. Older individuals may develop osteoporosis and have fragility fractures. Vitamin D has several roles in the body, including increasing the strength of your bones and muscles, reducing inflammation, optimizing your immune system, reducing cardiovascular health. Also, there has been some association with reducing certain types of cancers, dementia, and multiple sclerosis. And I've put a link to a meta-analysis here. It's interesting that vitamin D, although called a vitamin, is in fact a hormone because it does affect the synthesis of certain kinds of proteins through action into the nucleus. So that's the differentiation between a vitamin and a hormone. Here I have some discussion about the incidence of vitamin D deficiency and what kind of things can cause reduction. Skin pigmentation is very important. I'm going into the history of this. Initially, according to the Darwinian theory of evolution, all human beings were based in Africa. We were all dark skin colored. And as we migrated into areas where there was less sun, our bodies figured out that we needed more sun to be absorbed, because otherwise we would become deficient in vitamin D. So as human populations moved away from their equator, they lost their skin pigment melanin so that they could absorb more sunshine and produce more vitamin D. And an example of this is Cheddarman. The DNA analysis of Cheddarman, who was a caveman in the British Isles from over 10,000 years ago, showed that he had dark skin. Obviously, in the British Isles, over 10,000 years, they lost a lot of their skin color in order to be able to absorb vitamin D, which is very interesting because it just shows that we make a big fuss of skin color, but really all it is just your body's way of trying to keep its vitamin D levels up. So here we have some more research about the epidemiology of vitamin D and how skin color has an effect on that. Vitamin D is a fat-soluble vitamin, so it's better absorbed if you take it with fatty food, but then equally, if you're obese, it'll be more distributed in the fat, so less available. Also, high fructose corn syrup reduces absorption of vitamin D, which is interesting because we have mentioned and discussed this in more detail in our blogs about inflammation and fatty liver. There are also some observational studies suggesting that you can get more respiratory disease such as influenza if you're vitamin D deficient. And I have made notes and put links for all of these studies, including those related to COVID-19, on my blog, and I would encourage you to go on my blog and have a read for these things for yourself.